Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
This Class 5 cervical lesion has been treatment planned for an amalgam restoration. There is a cavitation and a loss of enamel and a penetration of decay down into the dentin. You will note the extension of the carious lesion laterally with a decalcification, a white chalky appearance, and staining that undermines the enamel of the buccal surface of this mandibular first bicuspid. You'll also note that the rubber dam has been placed and that a 212 cervical clamp has been put in position, supported by compound. This is to give a retraction of the tissue, to expose the carious area, and to give a better working site for us to restore this particular cervical area. Now, the method that we use in the preparation of this is not different than the Class 1, except that it is on the buccal surface. The carious area, as noted, is somewhat smaller, and therefore our selection of instruments will be of a smaller dimension. So in this particular case, using a high-speed operation, we are going to penetrate with a number 1 round burr. After we penetrate with the round burr, then we will extend, and then we will refine our cavity preparation, put our retention in, and we suspect that the depth of the decay will cause us to put a zinc phosphate cement base in. So we will begin to make our first cut, applying our round burr at the surface of the carious area, and make a penetration with our water spray, keeping the tooth cool and carrying away the debris. Now, as we're cutting here, we're observing constantly the depth to which this burr is cutting. The penetration, as you know, on the buccal surface of this tooth will be deeper at the occlusal than it will be at the cervical because of the thickness of the enamel walls. Now, we are stroking across here, cutting to this depth. Just drying the area out to observe our depth, seeing where our penetration has been made. We once again now will extend out. You can note that in many cases we are using both hands to steady the cutting as we proceed mesial and distally across here. Now, this happens to be a rather large carious area, and so therefore we're extending considerably to the mesial and to the distal with our round burr, being very, very careful to keep control over it at all times. Now, once we've opened our cavity preparation up and we've established an extension, we'll now go down to the 55 Fissure Bur for a more refined outline form. Now, in a clinic situation, you'll have the advantage of using your chip syringe, your 3-way syringe. In the laboratory, you'll have to use cotton pellets and cleanse your cavity preparation with your cotton pellets. And then with your chip blower, dry out your area. Now it's a good you have a good chance then to observe the outline form that you've established at this point. You've done your extension to detect the dentin with a scraping motion on there. It's as to density and to determine whether or not there is any more caries in the particular area that you have established. Now with the high speed, we'll begin to use our, in this case, a 55 Fissure Bur extending to the mesial and distal. Now, it's very important that you understand the direction that this burr is going to be applied to the tooth. We must not leave any unsupported enamel rods. So in a dry running fashion, we will want to tip our burr slightly cervical, and we certainly will want to tip our burr occlusally so that we impart quite a noticeable taper to that occlusal wall. Now, as we come to the mesial And as we go to the distal, we will tip our contrangle to meet the caval surface of the tooth and also to cause curvature to the axial wall. This in turn will protect the pulp. It's the curvature that we're establishing is compared to the caval surface curvature of the tooth, and it therefore is in the same curvature of the pulp chamber. So using our 55 burr, we will begin to establish our final outline form. Now these burrs cut very rapidly, and you must use a gentle stroking motion as you extend to the mesial and to the distal. Coming over to the distal now. Once again, establishing a cavity preparation that will have its mesial and distal sides rounded. It resembles somewhat the Farrier type cavity preparation in that the occlusal wall is longer from mesial to distal than is the cervical wall. Now we're coming over to the distal to rid that particular area of the decalcified enamel. You'll note the angle that I am holding the burr, trying to meet the caval surface at right angles to give the dentin full support. And as I go to the occlusal, I will tip my burr, give full taper to the wall. Now we're trying to establish an occlusal wall that is somewhat straight across from mesial to distal and then curves as we reach the mesial and distal sides of the preparation. Once again, you will note at the mesial there is a white area of decalcification. You must extend your cavity preparation over to include these areas. You cannot leave pitted, stained, or decalcified enamel. For if you do, you're inviting further recurrent decay and will not have a continuity of the amalgam restoration along its margins. All the time that I am cutting on these lateral surfaces, note that I am tipping this burr. The reason for this is to try to ensure curvature to the axial wall. Now we'll dry our cavity preparation off and observe our outline form. Now we'll do it visually and we'll do it tactily. The use of a number 3 cow horn explorer is the instrument of choice. We're running our instrument along our margins to feel if there is any break in the continuity. And right here we feel along that cervical margin that there's a bit of a chip that we would like to get rid of. Now as we work ourselves over mesially, we find that we're quite smooth. On the occlusal margin, at this point, we find some irregularity. Now we're checking the direction of that occlusal wall and the direction of the cervical floor at this point. Our axial wall that we've established has curvature to it. We've maintained some, but it has a degree of roughness and a stepping effect with a bit of decay right over in this area that we will want to remove after we have established the outline form. In other words, we're establishing convenience form, looking into the internal portions of the cavity preparation. Now we're checking the buccal surface of the enamel to see if any more structure must be removed to give good continuity to that enamel wall. And it appears that at the distal we have a bit of pitting at this point, and we'll want to extend over. Now at this point we're going into the final refinement of the extension. We'll go down to low speed with the 55 Fissure Bur. We don't need the rapid cutting for this refinement. We can observe by using this lower speeds the exact margin that we're shut our water off, and now we're down with our low speed contrangle, and we are doing the final extension. And again, we keep our burr tipped in the direction that will impart a taper to that wall. Trying to get rid of any overhanging enamel rods or any roughness to the enamel surface. Notice the brush-like stroking motion of the burr as you're cutting. We're supporting our burr with two hands. That just ensures steady cutting. As we stroke, we have the burr turning, in this particular case, in a counterclockwise position. We're stroking up that mesial wall. And now we are going to come across the occlusal wall with a proper taper. Try to rest on the arch that you're working on always. I think the most important thing that you ought to be able to observe here is the direction of the burr as it cuts. For this is the most important feature of these Class 5s, to get the right angle on the cutting burr so that it imparts the type of taper or undercut that you wish to obtain in your cavity preparation. Again, coming over distally just a little bit farther to make sure that we've now we'll check again with our number 3 Cowhorn Explorer, checking the continuity of this enamel, feeling the walls. Now it appears that we have removed any of the chipped or overhanging enamel, that we've eliminated the pitting effect over on the distal surface, that we have a sound enamel wall around our cavity preparation. Now, to ensure that we have this, we may select a 10/6/8 cutting instrument along our occlusal wall to plane in this direction. I'm trying to keep my hands away from the TV camera here a bit. You may want to come up closer to the tooth and support on the arch that you're working on. Note the angle that this instrument is being applied to the tooth and the shavings that are coming off in there, smoothing up that margin. The final margins of your amalgam restoration cannot ever be any better than the cavity margin that you prepare. If you prepare a smooth margin, you normally will have a very, very smooth wall, or smooth margin on your amalgam restoration. I think this is highly important to you for the success of these amalgams. We have one spot over in the mesial that appears to be a little bit on the soft state. It is not stained, but right in this particular area we're a little bit soft. That means that we must penetrate to a little deeper dimension here. So we will, at this point, take a number 2 round burr with a low speed handpiece, and we will gently penetrate into this area of soft dentin, right at this point. just gently stroke. We'll test once again. Dentin along here. Now we have just about eliminated all of the soft, possible carious dentin. Take a number 18 scoop spoon excavator. Dry off our site one more time to make sure that we have cleaned out all of the decay. Now, in this particular instance, we are going to have to put a small amount of retention to retain our zinc phosphate cement base. We'll put a bit of retention in the occlusal and in the cervical. Before we do that, we'll use a quarter round burr on our slow speed contraangle, and we will put our retention in for the amalgam. Now, students have difficulty putting retention in because of the lack of understanding of the application of the burr. It is not necessary to cut a deep trench into this tooth. It's merely necessary to cut a groove that would be, in this case, half of a quarter round burr on both the occlusal and the cervical walls, not cutting into the mesial and distal. Now, to dry run this a little bit, one could apply the burr against the tooth, touch the axial wall, feel the axial wall, and then run along that cervical wall in this fashion. With good control, you should be able to cut in laterally and not in axially. The same thing applies to the occlusal wall. Put the burr against the occlusal wall, run the burr back and forth from mesial to distal. Now, this effect will give you some guidance in the placement of this retention. So let us start now on the cervical. Feeling the wall, turning the burr on. Now we are proceeding from distal to mesial, pressing with the side of the burr against that cervical wall. What we're looking for and what we're testing is to see if we, in fact, do have the type of retention that we want. And what do we want? We want to be able to feel it. We want to be able to run the Explorer along the retentive groove, indentin. Retention is cut indentin. It allows a bit of dentin between the retentive groove and the enamel wall for support. The retention is not cut right at the dental enamel junction. Now what we want to do is establish retention up at our occlusal wall. Once again, feeling the axial wall, resting the burr on the occlusal wall, rotating the burr, and drawing it along that wall. What we are looking for then is, again, a groove going along that occlusal wall that we can feel with our Explorer, like so. We're actually feeling that groove. Now, it may be somewhat difficult for you to see it, but then our cues in these operations are visual and tactile. In many cases, your tactile sense will be more acute than your visual sense in determining if you have enough retention. Now we have the retention of the cavity preparation cut. We have the outline form established. We have the walls smoothed off with our hand instruments and our rotating instruments. At this point, we are going to put retention in, point retention in for the cement base. Again, we'll use our quarter round burr, and up at the occlusal portion, we'll put a point of retention into the dentin, being very careful not to cut in axially, but to get a locking point for our primary consistency cement. A little air will clean this area off, and now we'll go down cervically, and we'll create another locking point in the dentin, not at the depth of the decay, but where the normal depth of the dentin meets the carious or the former carious area where the decay has been removed. Final analysis of our cavity preparation now. We will observe that we've established an outline form that includes the former decayed area and is extended over distally and mesially, occlusally and cervically, to ensure that our margins now are on sound enamel that is dense and that the enamel rods have been cut in a direction that will allow us to condense amalgam and give us a final, secure, dense margin. We have carried the depth of the preparation to a normal depth, the approximate depth of a number 2 round burr, into dentin in all respects, but deeper in this area where where the carious lesion penetrated. We have established a retention groove at the cervical, seemingly somewhat hard perhaps to visualize or to see, but I think that one needs to have tactile sense and visual perception of these things, and actually you can see and feel the cervical groove. Now the occlusal groove, a little more difficult to see, but again, a groove that goes from the distal to the mesial, about half the depth of a quarter round burr in this particular cavity preparation, half to 3/4 of the depth. Not cut into the axial wall, but cut into the occlusal wall and into the cervical. Note also that we've established a point of retention at the occlusal portion of the decayed area at the normal depth for our primary mixed consistency cement, and at the cervical to give a locking effect for the secondary consistency that we will place in this area to restore the normal form of the cavity preparation.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.